Now it's time to talk health. And today, look, tomorrow, 1st of December, is World AIDS Day.
Yeah.
And we're going to be talking a little bit about that. But the angle we're looking at it from is mother to child transmission.
Yeah.
And now I'm not a doctor, I'm not a health professional, but we have someone who is. Dr. Kelvin Owusu.
Yes, the director of Optimal Care Diagnostics. And he's looking very,
he came. He came.
Yeah.
He came.
How are you doing today?
I'm very well.
Fantastic.
My tailor actually surprised me with this one just last
really?
night.
Oh, wow.
That's
This
clothing.
is a nice surprise.
Thank you very much.
Put us in touch with him. This is
I will. He's actually a cool guy. Thank you very much.
You're looking like $1 million.
Love it.
Oh yes, yes. I feel like $1 million.
Are you worth $1 million?
Well, this camp is on the way. It's
So I
coming.
start relating to it differently. In the morning when I wake up, good morning, Doc. How are you? Doc, please, can I wash your car? Can I cook for you?
Charlie, so World AIDS Day is coming up on us tomorrow.
It is.
And,
it is.
As a medical doctor, I mean, of course, we're going to be talking about mother to child transmission. How do you feel about where we are, HIV, AIDS-wise?
Well, I mean, we've come very, very far. I mean, from the back in the day when we first of all, many people didn't even believe it existed. At least now we know it's there and we are doing something about it. But interestingly, I think we've been distracted by COVID particularly, because it looks like the numbers are picking up again, especially in areas where previously they were a bit low. Now it's coming up a bit. So that's why it's important that we celebrate these days to sort of
remind us.
Yes, remind ourselves that it's still there, because it's still causing significant disease burden.
Okay.
And then of course it also has the implication on social life and all of those things, because now the pills you even have to take, quite a lot of pills to try and keep the disease at bay. So the more we know about it, the more we remind ourselves, the better prepared we are to prevent it, because obviously it's better to prevent it than to try to live with it. But of course, if you do get infected, there's still ways and means of surviving with the disease. I mean, there are people who are living their full life expectancy with HIV and AIDS, so there's still hope out there.
Okay. So talk about mother to child transmission. Is it possible for a child to live in this cocoon, for the period that it's living there, 9 months, without getting infected?
Well, the simple, straightforward answer is yes.
It is?
Yes, it is. You see, I think last week we touched on this a bit, and where I mentioned that the baby or the developing baby fetus is a parasite.
Yeah.
And so the body treats it, puts it in a shell so that the mother's immune system does not interact with that developing baby, because when that happens, the antibodies will destroy the baby. So in that regard, this is actually part of the reason why it's possible for the baby to live in that cocoon and not get infected, because it is shielded off from other parts of the mother's system. So that's why I say in simple terms, yes, it's possible. However, is it
that's always the catch.
Yes, that's always the catch. We know for a fact, I mean, HIV has been around for a while, so research has already shown that if a mother is HIV positive, the probability that mother will transmit that virus to the baby either during the incubation period or during the birthing process or during breastfeeding, that's after birth, it's up to 45%.
Oh wow.
Yes, so the chance of catching HIV from your mother in utero, intrapartum, postpartum is about 45%.
That's high.
That's very high. But this is why PMTCT is also very good, because that's prevention of mother to child transmission, has shown that you can actually reduce this incidence or this risk from that high of 45% to as low as 1%.
Oh wow.
So yes, so PMTCT actually works, and it's made a huge impact. In fact, between 2010 and 2018, about 1.4 million children who should have developed HIV because of their mother's status did not catch HIV.
Wow.
Yes, and so I mean, it's not now we are coming to confirm that it works. So it is already known that it works.
Know that it works.
Provided you as the mother is going to put yourself out there to receive the help, it works. PMTCT actually works, and it's actually going to prevent your child from catching HIV, from you, the mother.
Okay, so Doc, let's look at, first of all, preconception. What are some of the things, assuming a mother knows before she gets pregnant that she's HIV positive, that she's living with this, what are some of the things that, prevention of mother to child transmission has taught us within that bracket. And then after that, let's look at when the baby is sitting in the womb.
Yeah.
Because I mean, in recent times, and I've had to go through that twice, one of the tests, the blood tests that you're made to take is your HIV test while you're pregnant. And I'm just wondering how different the regime would have been if I had been positive then as opposed to preconception.
Okay, so the challenge is most people walking the streets don't know their HIV status, you know, and so that's actually part of the reason why it is part of we call it booking labs. So when you report to antenatal for the first time, they will actually request an HIV screen as part of your initial labs, because if you already knew you were living with it, then that information is irrelevant, you know. And so because many people don't know it, usually the first time they are diagnosed with having HIV is probably when they are going to get married, because some institutions require that you do some HIV tests and all that, or they actually develop a complication of HIV, then they come to hospital, and then as part of the investigations it is done, you know. Now if the diagnosis of the HIV is incidental, as in you're going to probably get married and then you did a test, then most likely you don't have any symptoms, you know. In that case, we have to follow you up, do other tests, CD4 count, viral load, to find out where your levels are, because these will determine whether we should start antiretrovirals or not. Okay. You see, because when the viral load is high, then the likelihood of transferring that virus to the next person you engage in sexual contact with is very, very high. So the aim is to keep the viral load as low as possible. Okay. Now, specifically for a woman who is not yet pregnant, if you're HIV positive, it means that your nutrition is even more paramount, because you know your immune system also functions on your nutritional status. So you want to make sure that you are eating well, so that your immune system is, you know, well ready, so that they can keep the HIV in check, because it is your white cells, your CD4 count, all these things are what's going to keep the HIV low, you know. And so before you get pregnant, you must make sure all these things are in there. And if you already know your status, then you must pretty much attend to an obstetrician before you even get pregnant, you know, so that they can take you through specific things you should do before getting pregnant. You know, preconception care is it's not common in Ghana, but if you know your status, you should actually go check it out. Now, if you do get pregnant and you report hospital, then they will do the test, and then it turns out to be positive. Usually this test should be done within the first trimester. I mean, this booking visit is done within the first trimester. That's the first 13 weeks. If it comes out positive, then like the similar follow-up, they will do the CD4 count, the viral load, to find out what your levels are. If your levels are okay, and when I say okay, I mean they are not too high, or your viral load is not too high, your CD4 count is also adequately high, then you don't need to start any antiretroviral therapy, because remember I mentioned that the aim is to keep the viral load low, you know. So if your level is already low, there's no need to start the antiretroviral therapy immediately. But you are going to be followed up all through the pregnancy. In fact, you are going to repeat the CD4 count and viral load every trimester. So which means they're going to do those tests about 3 times in the course of your pregnancy, so that we monitor the movement. And if it drops below a certain limit, you start antiretroviral. The idea is that we need to keep the viral load down. So there are actually a 3-pronged approach. You are going to check your viral load, your CD4 count. You might be put on antiretrovirals, and then when you do deliver, you are not going to breastfeed your baby. These 3 interventions aim at preventing the transmission of the virus. Of course, I left one thing out. Sorry. Then during delivery, most of the time, HIV positive mothers would not be allowed to deliver vaginally or normal delivery. They are going to be delivered through cesarean, because it is known that the commonest time for transmission is during labor. It's because the labor process is quite bloody, in quotes, you know. And so it's the probability that there's going to be a mixing of blood is much higher at that particular time. So in order to reduce that risk, there's going to be a cesarean section to deliver that baby.
Because that's more controlled.
That's more controlled, exactly. Yes, and so these are the three things you want to do: antiretroviral, cesarean delivery, and then no breastfeeding. You know. Of course, it does not mean that every woman who goes to cesarean section has HIV. It does not also mean that every woman who does not breastfeed their children has HIV.
Very important. Before we start stigmatizing people.
Exactly. We've actually had such situations, you know, because some, in our local terms, 2 known people, they think that once a woman is not breastfeeding their child, it means that that woman has HIV. It is not the case. There are so many reasons why a woman might need to introduce formula feeding for their baby. So many reasons. And I'm not even talking about the personal reasons. I'm talking about medical reasons. There are medical reasons why a child may be put on formula feeding instead of breastfeeding. You know, HIV is just one of many. You know, so I'm stressing on this point because I don't want people to go and be stigmatizing others because they're not breastfeeding their children. Of course, if you have no contraindication to breastfeeding, breastfeeding is a very, very important part of bonding. And even for the child to develop his or her immune system, breastfeeding is very, very important. So breastfeed your children. But if there's a reason why you should not breastfeed your children, follow the doctor's advice. Very, very important.
What I'm curious about, though, is when you say no breastfeeding, what's the problem there? Is there transmission through the milk?
Yes.
Is that what it is? Or?
Yes.
Okay.
There can be transmission through the breast milk, so that's part of the reason why.
So even expressing and feeding, it's the same problem.
Yes, because the virus is present in the milk. So whether you express or not, it's there.
So that, I mean, breast milk is classified in this case as a bodily fluid.
Yes.
Okay.
Yes.
So I'm just because usually when we hear about HIV and all the sensitization, I remember way back when I was in JHS, so I was a girl guide, and we were being taught to kill the stigmatization from home, because you know they say when you're young and you're taught something, you carry it home, then you teach your parents, and then it propagates. And all the things we used to hear, it's transmitted through bodily fluids. It's transmitted through bodily fluids. So breast milk is considered a bodily fluid.
And the baby can get the infection through breast milk. So that's why I mentioned that the transmission of the virus can happen in utero, as in the womb, during the birthing process, and after the birthing process. So the after portion is where the breast milk comes in. So breast milk is a way of transmitting the virus from the mother to the child. So that's why we discourage mothers from breastfeeding their children if they are HIV positive. You know, but again, of course, all these things also has a social context, because if the mother cannot afford to buy to buy the formula feed, and you know that, and I know she knows, I don't know if you know, that there are specific formula for specific ages of the baby.
Yes.
I know.
You know, it's not it's not
I've been there, done that. I know.
You paid attention.
No, I was waiting to see where you were going with it.
no, it's because a lot of
He's
people,
a very hands-on guy.
I know. I mean, he's a grandpa, so I mean, yeah.
Thank you, Dr. Usu. Thank you.
This is conspiracy 101.
Oh, you are a grandpa.
Okay, you please continue.
You know, so because a lot of people don't realize it, and they when you feed the wrong formula to the baby at the wrong age, you can cause problems for the baby's digestive system. Okay. You know, so the formula must be right. Then the water used to mix the formula must be right. In fact, I think the water is even more important, because if you use the wrong water, you're going to get a lot of reaction. The baby is going to have diarrhea, and then you end up having a malnourished child. And if a malnourished child with a weakened immune system is at a higher risk of even catching the virus, you know, if there was that small exposure, so you don't even want that child to be malnourished at all, you know. So the point I'm trying to make is that this whole discussion of HIV, PMTCT is set in a social context, because if the mother cannot afford the formula, then it creates a problem. You see, and so there are some women who might be HIV positive and they are still going ahead to breastfeed. In which case, then the focus is going to be on controlling the mother's viral load, making sure that the viral load is as low as possible. You know, because the antiretroviral drugs are subsidized to a large extent. You know, so if the mother can keep the viral load down, then again the risk of infection is reduced, even though it's still higher than if she wasn't breastfeeding at all. You know, so it's a difficult situation.
So, Doc, I mean, tomorrow is World AIDS Day, and this day has been commemorated for quite some time now. David started by asking a question: how are we doing? Where are we? And you mentioned that COVID has sort of taken us back a little bit. What's happening with COVID that's making that happen?
Well, I mean, a lot of the funding, a lot of the information, a lot of the education has focused on COVID, because COVID presents a a present
clear
risk,
and present danger.
exactly,
Yeah.
clear and present danger. So I mean, and again, COVID will, in a manner of speaking, will kill you faster than HIV. You know, before HIV will result in AIDS, it can usually take a couple of years. You know,
Yeah.
so a lot of people are more afraid of COVID. You know, and so we have lost sight of the HIV. And also, if you consider the fact that there was also a restriction in movement, and then restriction in terms of entertainment activities. You know,
people are chopping the wrong meat.
Exactly. The only source of entertainment for a lot of people was, you know, let's get in there and do our thing. You know, and so that may have also contributed. So I mean, it's the education is needed, and we need to revitalize that you know, education drive on HIV, because it's still there, it's still causing problems, and when you have HIV and COVID comes to add to it, that's double trouble. So we really need to up our game, you know.
Fantastic. Dr. Kelvin, how do people get in touch with you?
Well, I'm active on social media, Kelvin also MD, on all social media channels.
Fantastic. We will have you again on a different conversation.
Definitely.
It's always good and exciting to talk
Definitely.
to you.
And
It's good to
please,
be here.
if there are any World AIDS Day activities that we can join in, please do let us know.
All right.
We're all about creating the awareness and doing it in a hands-on manner.
Definitely,
So please let us
definitely.
know. Yeah,
All right.
please let us
Thank
know.
you. Well, Breakfast Daily has a lot more that's coming up. Don't go anywhere. We'll be right back.